Imagine your hand affected by Dupuytren's disease. The little finger is brought down to the palm by a tight band, and the next finger is also starting to bend from a separate band. Forget about trying to place your hand flat on the table. It's constantly stuck and getting in the way. We can help straighten this finger out with Dupuytren correction surgery. This is done by taking away all the thick Dupuytren band that drags the finger down. The hand is properly sterilized and a tourniquet is applied to stop bleeding. The surgery is commonly done under a full anesthesia and takes around an hour. The hand is then secured onto a flexible lead hand device. The incision is marked out with a blue surgical marker. The healthy skin that's not affected by the Dupuytren disease is carefully lifted up from the thick Dupuytren fascia underneath. The skin flap is then sutured to keep the incision wide open. This helps to expose every last bit of thick Dupuytren fascia so it can all be removed at once. Next, a dissecting scissors is used to isolate the Dupuytren fascia and separate it from the important nerve and blood vessels. Slowly and carefully, the Dupuytren fascia is cut out, while carefully preserving the tendon just below. This important part of surgical dissection not only tries to get rid of all the Dupuytren tissue, but also keeps safe the nerve and vessels that can sometimes get tangled up in the Dupuytren band. Once all the Dupuytren is removed, the surgeon manipulates the finger to test and make sure it stays straight. There are often small leftover Dupuytren band on the side of the finger that needs further release to stop the Dupuytren disease from coming back. All the bleeding spots are stopped with cautery and wound is washed. After the local anesthetics is given, the painstaking process of wound closure begins. This often includes a zigzag closure to prevent scar tethering of the finger. Here is a previous patient with Dupuytren contracture of his ring finger. This is the end of his surgery, where the finger is now straight with much better functions. Please check out this link if you are interested in Dupuytren contracture.